Lori, thank you for being here. We got hints of this the other day when the incoming administration suggested that or at least doctors advising the incoming Biden administration warned that the Trump administration's plans and projections about how this vaccine is getting out here do not seem to be accurate. What do you make of this situation?
Ali, I think there's a lot going on here, and it's many different levels, and it may not be quite as politically motivated as it seems, though we can't utterly discount that. First of all, General Gustav Perna is in charge of Operation Warp Speed. And he told reporters 3 days ago that because of the big nor'easter that was coming in to slam the eastern and midwestern states with snow and high winds, it was likely there were going to be airplane disruptions and transportation disruptions. And as a result, he was going to hold back some of the promised vaccine as a security precaution. He didn't say exactly how much, but it appears that did occur, and that was in part because of concerns that FedEx and UPS would not be able to make all their deliveries. And indeed, FedEx and UPS did have a lot of flight delays. Lots of airports were shut down, at least temporarily, over the last few days. And so that may all have been some legitimate snafus and concerns. And obviously, given how precious a cargo of Pfizer vaccine is at this point, losing a flight load or having a plane sit on the tarmac and the vaccine goes bad would be a horrible, horrible thing to have happen. So you can sort of understand that, but there's been no clarity beyond the initial comments made by Governor Perna 3 days ago on this. And all the states have either been told, you've misread the instructions, you've misread the invoices, or nothing, just wall of silence. And the real crisis with this, Ali, is that, we're still at very early stages with very small amounts of vaccine that we're trying to roll out. We haven't even come close to getting to the point of trying to roll out 20 million doses a day or 30 million doses a day around America. And for that scale, and what's supposedly coming, assuming the vaccines really do roll out of those warehouses and are really produced and fill the warehouses, what's coming up is going to be a scale of activity that the National Governors Association said on November 25th would require $8 billion of additional resources for the states, because all of the state public health departments are now completely overwhelmed. They don't have a single extra human to do anything, much less be in charge of distributing vaccines and so on. And the response from the federal government was this week, the CDC said, hey, 50 states plus territories, here's a check for 227 million of the 8 billion you said you absolutely had to have.
Yeah. Just in the last few minutes, Lori, the governor of Washington State, Jay Inslee, tweeted some new information about this story that you and I are discussing about states receiving fewer vaccines next week. He said this, quote, I had a very productive conversation tonight with Operation Warp Speed regarding the reduction in state vaccine allocations for next week. It appears this is not indicative of long-term challenges with vaccine production. General Gus Perna, whose candor I appreciated, explained that prior allocations were inadvertently based on vaccine doses produced, not all of which have yet completed quality control and are releasable. This discrepancy was the source of the change in allocations. At this time, there's no indication further reductions are likely to occur. That is good news. We continue to celebrate the availability of this vaccine and what we hope to be a stable supply going forward. So that speaks to your suggestion that Gus Perna's on it and that it may not be political. It is a little bit amazing, though, that you had Alex Azar on TV saying nothing is wrong when, in fact, something is wrong, and the governor of Michigan saying she can't get a call back from him. It's a continuation of a picture you and I have been talking about for a few months, putting politics aside, just being effective about this.
Yeah. Ali, you and I have talked about the gang that can't shoot straight. And this is certainly what we've been seeing with the federal government. It's ironic that on the R&D side, of Operation Warp Speed, we have seen reality materialize in record speed with now 2 approved vaccines and 3 or 4 in the near pipeline. So that's incredibly exciting. But getting it out of the door and handling all the logistics is a nightmare. And one of the reasons it's really been exacerbated is that the Trump administration's policy from the earliest days of this epidemic in America, going back to February and March, has been to say the states are in charge. We're just going to hand everything over to you. You find your PPEs. You find your personnel. You find this, that, and everything else. And now,
right.
Hey, you figure out how to distribute
now they're
vaccines.